Bonjour tout le monde. It's good to be here this morning with Dr. Tam and Dr. New, as well as Minister Leblanc, who's joining us virtually. I want to start this morning by addressing the unacceptable threats that were sent to a Toronto mosque over the weekend. Islamophobia and right-wing extremism have no place in our country or our communities. We must always stand united against hate or intolerance of any kind. Je tiens aussi à revenir sur le drame survenu à Wendake lors de la fin de semaine. Mes pensées sont avec les proches des jeunes victimes de ce drame terrible et avec les gens de la communauté de Wendake. Il faut faire toute la lumière sur ce qui s'est passé. Ces jeunes enfants avaient la vie devant eux et nous sommes tous bouleversés par la situation. Nous vivons des circonstances inhabituelles. La fin de semaine de l'Action de grâce vient de se terminer et plusieurs n'ont pas pu se rassembler avec leurs proches comme ils l'auraient souhaité. Mais malgré les difficultés causées par cette crise mondiale, les Canadiens sont plus solidaires que jamais. Au printemps, on a aplati la courbe en faisant chacun notre part. Cet automne, je sais qu'on peut faire la même chose. En continuant de télécharger l'application gratuite Alerte COVID, comme l'ont déjà fait 4,3 millions de personnes, en portant nos masques et en gardant nos distances, on va aplatir la courbe à nouveau et passer à travers cette pandémie. Et pendant que vous redoublez d'efforts pour aider vos proches et votre communauté, vous pouvez compter sur votre gouvernement. Il va toujours être là à vos côtés. With rising COVID-19 cases, quick and accurate testing deployed with the right strategy has become more important than ever. That's why our government has been working around the clock with the provinces and territories to boost their testing capacity while at the same time securing the world's best rapid testing technology. These efforts are paying off. As Minister Anand announced, Canada recently secured up to 28.4 million rapid tests from Abbott. And on that front in particular, we're continuing to move forward. Shortly, the federal government will be sending these new rapid tests, Abbott PanBio and Abbott ID Now, to the provinces and territories. Both of these new testing technologies are quick and reliable, so we're getting them out to the front lines as soon as possible. Our government is also continuing to provide surge support on processing tests, including for Ontario. And for the First Nations communities of Casabonica and Pikangikum, National Microbiology Lab employees are on the ground with testing kits. It is vital that these communities, with cases of COVID-19, have the necessary testing capacity to control the spread of the virus and keep people safe. From day one, we've worked with the provinces and territories to protect the most vulnerable. Moving forward, that's what we will continue to do. Soon, more Canadian Red Cross support will be deployed to a number of long-term care facilities. Seniors must be safe and well cared for, and our government stands ready to help provincial counterparts in that work. This is a point I will continue to make with the premiers at our 20th First Ministers meeting this coming Thursday. Notre gouvernement travaille sans relâche pour acheter de nouveaux tests de dépistage rapides, les distribuer aux provinces et territoires et assurer un soutien d'urgence dans les communautés pour le traitement des résultats. En ce qui concerne les vaccins, les progrès se poursuivent aussi. Vers la fin de la semaine dernière, Santé Canada a reçu une demande d'autorisation pour le candidat vaccin de Pfizer et BioNTech. Comme pour la demande d'AstraZeneca il y a 2 semaines, c'est une autre étape de plus vers un vaccin sûr et efficace pour les Canadiens. Et à ce sujet, j'aimerais aussi rappeler à tout le monde de se faire vacciner contre la grippe cet automne. C'est un bon moyen de se protéger tout en aidant les hôpitaux et les cliniques de dépistage à se concentrer sur la lutte contre la COVID-19 sans se laisser distraire par la grippe. Our top priority is keeping you and your family healthy and safe. That means protecting you from this virus, and it also means ensuring you have the support you need to weather this storm. Yesterday, applications opened for the new Canada Recovery Benefit. The CERB provides $500 each week for up to 26 weeks for people who are self-employed or don't qualify for employment insurance. Since yesterday, over 240,000 applications have been received. If you need this help but haven't applied yet, go to CRA's My Account through canada.ca or call 1-800-959-2019 or 1-800-959-2041. The application process is simple. In fact, if you've used the CERB, you'll find it very similar. Our government will continue to do everything we can to support people through this crisis, whatever it takes, as long as it takes. If you get COVID-19 and aren't covered at work, the Canada Recovery Sickness Benefit is there for you. If a family member gets sick and you need to care for them, look to the Canada Recovery Caregiving Benefit. If you're affected by COVID-19, we've strengthened employment insurance to be there for you. And if you can't access EI, the Canada Recovery Benefit is able to help. And for business owners, there's more support too. This crisis has been very difficult for businesses across the country. So we've strengthened major programs that we created that have been a lifeline for them. On Friday, we outlined the new Canada Emergency Rent Subsidy, an expanded Canada Emergency Business Account, and the extension of the wage subsidy. The new rent subsidy will provide support to businesses directly, not through landlords. And the CEBA includes an additional $10,000 forgivable loan for those who need it. We'll also work to help businesses that temporarily shut down because of local public health directions. Canadian businesses create jobs and drive our economy, and we will continue to be there for them every step of the way. Beaucoup de gens sont au retour au travail, mais plusieurs sont encore affectés par la crise. On a donc renforcé l'assurance-emploi pour vous soutenir. Depuis hier, les travailleurs autonomes et ceux qui ne sont pas admissibles à l'assurance-emploi peuvent demander la nouvelle prestation canadienne de la relance économique. Cette prestation est de $500 par semaine pendant un maximum de 26 semaines. Si vous en avez besoin, mais n'avez pas encore demandé, visitez la page Mon compte de l'Agence du revenu du Canada en passant par le site canada.ca ou téléphonez au 1-800-959-2019 ou au 1-800-959-2041. Le processus de demande est simple. En fait, si vous avez demandé la PCU par le passé, vous verrez que la façon de procéder est sensiblement la même. Si vous contractez la COVID-19 et n'êtes pas couvert au travail, ou si un membre de la famille tombe malade et que vous devez en prendre soin, il y a aussi la prestation canadienne de maladie pour la relance économique et la prestation canadienne de la relance économique pour proches aidants qui peuvent vous aider. On offre aussi, bien sûr, plus de soutien aux propriétaires d'entreprises. Vendredi dernier, on a présenté des mesures élargies pour ce qui est du loyer, du salaire et des prêts sans intérêt, ainsi que des mesures ciblées pour les entreprises touchées par les consignes d'autorités locales de santé publique. Les entreprises canadiennes créent des emplois et stimulent notre économie, et elles peuvent compter sur nous. We're all waiting for the moment when this pandemic is finally over, for the time where we can once again have a big family dinner, go to a crowded festival, or just have life return to normal. Those days will be back, but only if we all keep doing our part. The numbers are still rising. This is the time to double down on our efforts to stop the spread. Our loved ones, our vulnerable family members, our frontline workers, they're counting on us to do the right thing. So follow public health guidelines and wear a mask. Keep your distance and join the over 4.3 million Canadians who've already downloaded the free COVID Alert app. Together, we will get through this. Thank you. I'm happy now to pass it over to Minister Leblanc. Dominic.
Thank you, Prime Minister. As COVID-19 cases continue to rise across the country and make their way into more provinces and territories, I'd like to reiterate what the Prime Minister has said since the beginning of the pandemic. The federal government is here to help. Minister Freeland announced last week new measures to help businesses, such as the new rent subsidy program. These measures, in addition to a number of others, will help affected businesses during the pandemic, which is also important, as the Prime Minister and the Minister said last week, to allow local public health authorities to make the decisions they must make that are important to the continued protection of public health. Alors que les nouveaux cas de COVID-19 continuent de grimper, je tiens à réitérer que nous sommes là pour les provinces et les territoires. La semaine dernière, la ministre Freeland et le Premier ministre ont annoncé de nouvelles mesures pour aider les entreprises canadiennes. Ces mesures sont là pour supporter les entreprises affectées par la pandémie et permettent aussi aux autorités locales de mettre en place les mesures qu'ils jugent nécessaires pour contenir cette seconde vague. Ahead of Thanksgiving weekend, our government announced an additional contribution of $100 million to Canadian food banks. This week, I invite everyone to take an action that will help someone in their community, whether it's giving to a local food bank or calling someone who may be isolated because of a second wave of COVID-19. There is a way for all of us to help one another. Merci, Monsieur le Premier Ministre, and I'm now happy to turn it over to Dr. Tam.
Bonjour à toutes et à tous. There have been 182,839 cases of COVID-19 in Canada, including 9,627 deaths. Nationally, there are close to 19,000 active cases across the country. Labs across Canada have tested an average over 77,000 people daily over the past reporting week, with 2.4% testing positive. While there are reporting limitations over the long weekend, based on the information available, Ontario and Quebec continue to report the majority of cases. In addition, some of the smaller provinces, including Saskatchewan, Manitoba, and New Brunswick, reported notable increases in cases. Over the weekend, I enjoyed hearing about the many creative ways that Canadians celebrated Thanksgiving while keeping up with good public health practices. Thank you to all those who did their part by celebrating safely. Finding ways to stay connected socially while physically distanced will continue to be key to our work together for the ongoing management of COVID-19. As we have said before, the virus that causes COVID-19 can spread quickly without us knowing it is present in our friend and family groups or in our communities. People who are infected can transmit the virus before they develop symptoms or without ever developing any symptoms at all. This is why we must all continue with good personal public health practices, even in areas of the country with few identified cases. As we have seen in recent weeks, a number of communities that did very well at preventing outbreaks in the spring are now facing new clusters of cases. When new chains of transmission emerge, a community's best defense is the individual actions of the community members to limit opportunities for the virus to spread further. The actions of individuals are critical in areas with higher incidence. Public health authorities cannot manage the resurgences on their own. While testing and tracing, together with isolation and quarantine, remain foundational elements of the COVID-19 strategy, public health authorities cannot get ahead of the spread of the virus where cases have large numbers of contacts they may have been exposed. As we said in our epidemiology and modeling update last Friday, we must all keep our number of contacts with others low, particularly in areas of high incidence. This will not be easy and will require hard choices between what we need to do and what we would like to do. But the more we can do our part to reduce the spread, the less local health authorities will have to rely on broader measures like business closures to reduce COVID-19 exposures and manage resurgences. It is a fine and challenging balance, but together we can find ways to keep COVID-19 activity at manageable levels and limit severe illnesses and deaths while also minimizing disruption to society. Thank you.
Bonjour à tous et à toutes. Au Canada, il y a eu 182 839 cas de COVID-19, dont 9 627 décès. À l'échelle du pays, il y a près de 19 000 cas actifs. Les laboratoires partout au Canada ont analysé plus de 77 000 tests de dépistage au cours de la dernière semaine, dont 2,4 se sont révélés positifs. La longue fin de semaine aurait occasionné des contraintes en matière de signalement de cas, mais selon les données disponibles, l'Ontario et le Québec signalent toujours la majorité des cas. De plus, on a signalé une augmentation considérable de cas dans des plus petites provinces, dont la Saskatchewan, le Manitoba et le Nouveau-Brunswick. Au cours de la fin de semaine, nous avons aimé entendre parler des nombreuses façons créatives dont les Canadiens ont célébré l'Action de grâce tout en continuant de suivre les bonnes pratiques de santé publique. Nous remercions tous ceux et celles qui ont apporté leur contribution en célébrant cette fête en toute sécurité. Dans le contexte de la gestion continue de la COVID-19, la clé de notre collaboration sera toujours de trouver des moyens d'entretenir les liens sociaux tout en maintenant la distanciation physique. Comme nous l'avons déjà dit, le virus qui cause la COVID-19 peut se propager rapidement sans que nous sachions qu'il est présent dans nos groupes d'amis et nos familles et au sein de nos collectivités. Les personnes infectées peuvent transmettre le virus avant de présenter des symptômes ou sans jamais en ressentir le moindre symptôme. C'est pourquoi nous devons tous continuer de suivre les bonnes pratiques individuelles de santé publique, même dans les régions du pays où peu de cas de COVID-19 ont été signalés. Comme nous l'avons constaté dans les dernières semaines, certaines collectivités qui ont réussi à prévenir les éclosions au printemps font maintenant face à de nouvelles grappes de cas. Lorsqu'une collectivité est confrontée à de nouvelles chaînes de transmission, sa meilleure protection est l'action individuelle de ses membres pour limiter les possibilités que le virus se propage davantage. Les actions individuelles sont d'une importance cruciale dans les régions où l'incidence du virus est élevée. Les autorités de santé publique ne peuvent à elles seules gérer les recrudescences de la COVID-19. Le dépistage et la recherche de contacts, ainsi que l'isolement et la mise en quarantaine demeurent des éléments fondamentaux de la stratégie de lutte contre la COVID-19. Toutefois, les autorités de santé publique ne peuvent garder la propagation du virus à son minimum lorsque les personnes infectées ont été en contact avec un grand nombre de personnes qui risquent d'avoir été exposées au virus. Comme nous l'avons indiqué dans notre mise à jour sur l'épidémiologie et la modélisation vendredi dernier, nous devons tous limiter notre nombre de contacts, surtout dans les régions où l'incidence est importante. Ce ne sera pas facile et nous ferons face à des choix difficiles entre ce que nous devons faire et ce que nous aimerions faire. Cependant, plus que nous contribueront à la réduction de la propagation, moins les autorités locales de santé publique auront à s'en remettre à des mesures rigoureuses comme les fermetures d'entreprises pour réduire les expositions à la COVID-19 et de gérer les recrudescences. Il s'agit d'un équilibre fragile, mais ensemble, nous pouvons trouver des moyens de maintenir l'activité de COVID-19 à des niveaux gérables et de limiter le nombre de cas graves et de décès, tout en réduisant au minimum les perturbations de la société. Merci.
Thank you, Dr. New. The Prime Minister will answer a question for a total of 20 minutes that will be equally divided by journalists on the phone and journalists in the room, starting with the phone today. Doctors and Minister Leblanc will remain available afterwards. Le Premier ministre va répondre à des questions pour 20 minutes aujourd'hui, en commençant par le téléphone et les journalistes dans la salle. Le ministre Leblanc et les docteurs vont rester disponibles par la suite. Opérateur, première question au téléphone.
Thank you. Merci. Première question, Émilie Bergeron, agence QMI. À vous.
Oui, bonjour, M. Trudeau. J'aimerais savoir que pensez-vous de l'idée d'un comité spécial anticorruption pour que les enquêtes qui avaient lieu sur l'affaire We Charity reprennent et se poursuivent?
Nous, notre priorité en tant que gouvernement demeure la COVID-19. On est dans une deuxième vague maintenant. Nous devons d'être là pour appuyer les petites entreprises, les familles, les travailleurs à travers le pays, pour travailler avec Santé Canada et nos partenaires internationaux sur des vaccins. Nous allons continuer d'être focusés sur la COVID-19. Les conservateurs veulent parler de la petite politique, veulent parler de We Charity. Nous, il y a des mois que j'ai paru au comité, que j'ai répondu à des questions, qu'on a fait parvenir des milliers de pages de documents, qu'on a répondu à ces questions. S'ils veulent continuer de parler de ça plutôt que de se concentrer sur les Canadiens, c'est leur choix. Les comités feront leur travail de façon indépendante. Nous allons rester ancrés dans la réalité que les Canadiens vivent maintenant, qu'est la COVID-19. We are entirely focused on the second wave of COVID-19. We are working to support Canadians, to support workers, to support families, to support small businesses as we get through this second wave. We will continue to stay focused on what we need to do to support Canadians facing a very difficult time right now. The Conservatives continue to want to focus on We Charity, so be it. I appeared at committee myself months ago. We released thousands of pages of documents. We've been open and transparent on these questions. But if the Conservatives continue to want to focus on that, they certainly can. We will stay focused on Canadians while we let committees do their work independently.
En suivi, Émilie.
Follow-up question, Émilie. Oui, sur un autre sujet, ça fait déjà plusieurs semaines que vous êtes engagé à avoir une rencontre formelle avec les premiers ministres provinciaux sur la question des transferts en santé. Vous avez parlé d'une réunion cet automne. Or, il semble qu'il n'y a pas de date qui a été encore fixée. Est-ce qu'on parle encore d'une rencontre à l'automne ou ça pourrait finalement avoir lieu après Noël?
Non, on s'est engagé à se rencontrer cet automne pour parler des transferts en santé. On va certainement en parler et on va certainement l'avoir. Mais moi, j'ai hâte à ma 20e rencontre avec les premiers ministres qui va se passer plus tard cette semaine, où on va parler de plusieurs choses, dont certainement la situation dans nos centres d'aînés et de soins de longue durée qui font face malheureusement encore d'énormes défis malgré tous les efforts que nous avons faits au printemps pour appuyer les provinces et avec l'armée canadienne et avec la Croix-Rouge. Nous allons continuer de chercher comment mieux appuyer les provinces pendant qu'ils font face à cette réalité extrêmement troublante d'encore trop de cas dans nos centres de longue durée.
Thank you, operator. Next question.
Thank you. Merci. Next question, Christy Kirkup, The Globe and Mail. Line open.
Hello, thanks for taking our questions. The federal government was warned years ago that the Public Health Agency of Canada was destined for serious problems unless changes were made to oversight, and yet two top doctors told the Globe that those concerns were ignored. Prime Minister, what is your response to this?
We all knew that under the previous conservative government, there were massive cuts to science. There was marginalization of scientific voices. There was a putting aside of experts in an attempt to cut the budget, cut the deficit at all costs on the backs of Canadians. We made historic investments in science. We've worked to restore many of the cuts made to our institutions over 10 long years. We will continue to work with our scientists and our experts every step of the way. I'm pleased to be working with the Public Health Agency of Canada every single day to ensure we're doing everything necessary to keep Canadians safe during this pandemic, and we will continue to focus on doing what is necessary to support Canadians through this.
Following up.
Yeah, just on another matter, Prime Minister, I know you just spoke to the issue of the We controversy. I take it, based on your answer today, that you don't support the creation of a separate committee to study what happened with the We charity.
Our government is focused in almost all our ministries, all our departments, and all the public servants on trying to contain and prevent further spread of this crisis, of this virus. to prevent further Canadian deaths. We have an awful lot of work to do, and we're going to continue doing it, but that needs to remain our focus. The opposition can focus on whatever it is they want. We will stay focused on Canadians. Notre gouvernement, dans toutes ses différentes agences et départements, sont solidement ancrés dans la réalité de la COVID-19 auxquelles font face trop de Canadiens, avec des résultats tragiques, avec des résultats extrêmement difficiles pour les petites entreprises et pour tous les Canadiens. Nous allons rester ancrés dans leur réalité. Nous allons focuser sur eux. Les conservateurs peuvent bien faire ce qu'ils veulent.
Thank you. Operator, next question on the phone.
Thank you. Merci. Prochaine question. Marie Vastel, Le Devoir. À vous.
Question from Le Devoir.
Oui, bonjour. Ma question est pour vous, M. Trudeau, mais si M. Leblanc a quelque chose à ajouter à titre de ministre des Affaires intergouvernementales, il est le bienvenu à le faire. On a vu récemment, M. Trudeau, que Québec a mis 3 mois à accepter votre aide de téléphoniste de Statistique Canada pour aider les provinces à faire du traçage de contacts. Québec avait aussi d'abord rejeté l'application Alerte COVID cet été. Comment est-ce que vous comprenez cette réticence apparente-là de Québec à accepter l'aide d'Ottawa et est-ce que ça vous semble acceptable comme comportement en pleine pandémie, en pleine deuxième vague?
Le rôle du gouvernement fédéral, c'est pas de juger les réponses des autres, c'est d'être là pour les appuyer. Depuis les débuts, on a démontré aux provinces qu'on était là pour les appuyer, avec du matériel de dépistage, avec du traçage de contacts, avec de l'équipement de protection individuelle, avec tous les différents outils dont on disposait, et on en a créé d'autres, comme l'application Alerte COVID. On reconnaît que les différentes provinces ont tous différentes réalités en termes d'impact de COVID-19 et vont faire leur propre choix. Nous, on est là pour les aider dans les choix qu'ils feront. On va continuer d'être là pour aider. C'est pas ma place de critiquer ou de juger, c'est ma place d'aider, comme on a aidé directement des millions de Canadiens, des centaines de milliers de petites entreprises, comme on aide les 10 provinces et 3 territoires à faire face à cette pandémie. Nous allons continuer d'être là pour appuyer les provinces dans les décisions qu'ils prennent.
En suivi, Marie?
Peut-être M. Leblanc a quelque chose à dire ou non?
Non, le premier ministre l'a très bien dit.
Okay, j'ai essayé. En suivi, M. Trudeau, vous avez mentionné que la Croix-Rouge va rester en plus grand nombre dans certains centres de soins de longue durée. J'aimerais juste préciser, est-ce qu'ils vont rester plus longtemps? Combien d'entre eux au Québec? Et encore sur les centres de soins de longue durée, vous avez dit que oui, vous allez tenir une rencontre sur la santé cet automne, mais vous avez surtout hâte de parler aux premiers ministres provinciaux cette semaine de la situation dans les centres de soins de longue durée. Est-ce que j'en comprends que vous comptez cette semaine revenir à la charge avec cette idée de normes nationales dans les CHSLD et autres résidences?
Je pense que tous les Canadiens veulent savoir que leurs parents, leurs grands-parents et nos aînés sont protégés, sont bien appuyés à travers le pays. Je pense que c'est important de reconnaître le besoin de protection pour tous les Canadiens, tous les aînés à travers le pays. C'est une conversation évidemment à avoir avec les premiers ministres des provinces, mais je pense qu'on ne devrait pas voir des aînés mieux protégés ou moins bien protégés dans une région du pays que de l'autre. Je pense que il nous revient tous de travailler ensemble pour assurer des soins de qualité pour tous les aînés et je vais certainement en parler avec les provinces. I think no Canadian wants to see their parents, their grandparents, their loved ones not well cared for in facilities across the country. I don't think there should be some regions of the country that offer better or worse protections to elders than others. I think that's why the time has come for a conversation between the federal government and the provinces on harmonizing and establishing norms for long-term care right across the country so that all Canadians can be reassured that wherever they live, we're going to take care of elders who deserve the very best from all of us.
Thank you. On va maintenant passer à les questions dans la salle.
We're now moving to questions in the room.
Good morning, Tonda McCharles with the Toronto Star. Prime Minister, it's 50 years this week since your father reestablished diplomatic ties with China, a country where you remain powerless to gain the freedom of these two Canadians. So I'd like to know a few things. What can you tell us, given the most recent contact governments had with those two men? What is your government's plan to reframe that diplomatic relationship? Is it time to end formal diplomatic ties? What is your plan on a go-forward basis?
The world has changed significantly in the past 50 years, and China has changed significantly as well. It's now the second largest economy in the world and has a significant economic impact on countries around the world, including in Canada. We will continue to work with China for advancing Canadian interests and Canadian producers. At the same time, we will remain absolutely committed to working with our allies to ensure that China's approach of coercive diplomacy, its arbitrary detention of two Canadian citizens alongside other citizens of other countries around the world, is not viewed as a successful tactic by them. It has put a significant strain on Canada-China relations, and we will continue to highlight our concern for the Canadians detained, our concern for the protection of human rights in places like Hong Kong and Xinjiang province with the Uyghurs. We're going to continue to work with our fellow like-minded nations around the world to impress upon China that its approach to internal affairs and global affairs is not on a particularly productive path for itself or for all of us. Depuis 50 ans, on a vu beaucoup de changements dans le monde, y compris en Chine. La Chine est maintenant rendue la deuxième plus grande économie de la planète et c'est un partenaire économique important pour des pays à travers le monde, incluant pour le Canada. En même temps, nous devons reconnaître que l'approche de diplomatie coercitive qu'emploie la Chine, y compris avec ces deux Canadiens détenus de façon arbitraire, leur approche sur les droits humains, que ce soit pour les Ouïghours ou pour les citoyens de Hong Kong, nous préoccupe énormément et nous allons continuer de travailler avec nos alliés pour souligner à quel point ces gestes et ces approches du gouvernement chinois ne sont pas dans leur intérêt, certainement pas dans l'intérêt de la communauté mondiale.
Bonjour, M. Trudeau, Louis Blouin de Radio-Canada. Malgré le décès de Mme Echaquan, le premier ministre du Québec refuse toujours de reconnaître qu'il y a un problème de racisme systémique. Est-ce que vous en avez parlé avec lui? Si oui, qu'est-ce que vous lui avez dit? Et est-ce que le fait de ne pas reconnaître ça, ça n'ajoute pas un obstacle à la réconciliation au Canada? Et qu'est-ce que ça changerait si M. Legault décidait de reconnaître ça?
Je ne veux pas parler pour d'autres premiers ministres ou d'autres paliers de gouvernement. Mais au gouvernement fédéral, nous savons depuis longtemps que de reconnaître le racisme systémique, c'est la première étape nécessaire pour marcher sur cette voie de réconciliation, d'éliminer ces barrières réelles et cette violence qui est trop souvent faite contre les peuples autochtones à travers le pays et aussi d'autres minorités visibles. Nous devons de travailler de concert. J'ai été très content de pouvoir sortir un communiqué avec tous les premiers ministres provinciaux au printemps qui parlait des défis que nous avons avec le racisme au pays. Mais je continue d'encourager toutes les personnes en position d'autorité, pas juste des politiciens, mais aussi des chefs d'entreprise, des leaders communautaires, de reconnaître la réalité du racisme systémique et de continuer et de s'engager à lutter contre cette injustice qui dure depuis trop longtemps dans notre pays.
Prime Minister Michael Couture from Global National. You talked just in your opening remarks about deploying the rapid tests to the provinces, but your government still hasn't given a lot of details on them. So when you give them to the provinces, will the federal government essentially say, this is where we want them? And why aren't you sharing more details about where these rapid tests will be used?
First of all, we've had rapid point-of-care testing in Canada since the spring. It has been deployed in remote communities and northern communities where the challenges around testing were quite significant in terms of distance. We continue to ensure that Health Canada moves forward on approving safe, reliable, and rapid testing technologies as they become available. And as we announced, we've secured over 28 million tests for use across this country in the coming times. We know that rapid testing is a key part of the path forward, but it is not in and of itself a panacea. It is going to be important that it be deployed properly to maximize the impact, to maximize the effectiveness of a strategy that has rapid testing, traditional testing, contact tracing, an effective app, and many measures put in place to control the spread of this virus. We will continue to work very closely with the provinces on strategies to ensure that we are maximizing the impact of all the technology we're able to deploy together.
Services employees see the
Sorry, can you start it again? Your mic wasn't working.
Sorry. So the Federal Commission review says the Canadian Security Intelligence Service employees see the spade work required to obtain judicial warrant as a burdensome and a, quote, necessary evil that detracts from more valuable activities. It calls for a cultural shift at CEAS. Do you see any evidence that this is happening?
Canada has among the best security and intelligence agencies in the world, and we fully support them in the work that they're doing. We are also a country that has a very strong Charter of Rights and Freedoms that protects people's rights and liberties. And we need to make sure that everything we do in order to keep Canadians safe falls within the law and the expectations and the values of Canadians, and we will always do that.
Hi, Prime Minister. Tom Perry with CBC. A few days back, you revealed that over the summer you had a COVID test that came back negative. I'm just wondering if moving forward you'll commit to telling Canadians if you're self-isolating, if you're getting tested, keep them up to date on your health status.
I've always been open about my health status with Canadians, as we had many questions way back when Sophie first had tested positive for COVID-19. I remember many discussions with media and others on why I didn't get tested, and the answer was public health authorities were not recommending at that time that someone asymptomatic be tested. In September, I had a bit of a sore throat. I went to see my doctor. I got tested. It came back negative. You could certainly know that had I tested positive, you would have known about it and we would have discussed it. I see no problems in keeping everyone apprised of the relevant details of my health and well-being. I have done that and I will continue to do that.
Or if you're going to go through another test, you're going to tell Canadians at that moment, not after the fact?
I will certainly take all the directions from Health Canada on how to behave and how to make sure that I'm not putting anyone around me at risk. That is the absolute priority. And when we have things to share, I will share them with the media, obviously.
En français.
Comme vous savez, je suis à chaque étape les directives de Santé Canada sur ma propre santé. Quand j'ai eu un mal de gorge au mois de septembre, je me suis fait tester et ça a été négatif, mais j'avais suivi toutes les procédures nécessaires. Évidemment, si jamais il y a un test positif, vous allez le savoir. Et si je dois prendre des mesures pour m'isoler, vous allez aussi le savoir. J'ai toujours été transparent à ce niveau-là.
Merci, c'est tout le temps que le Premier ministre a avec nous aujourd'hui. On va maintenant continuer la conférence de presse avec les docteurs et le ministre Leblanc en retournant au téléphone. Opérateur, première question au téléphone.
Thank you. Merci. Next question, Kevin Gallagher, CTV National News, line open.
Hello, this question is for Dr. Tam. When it comes to the rapid testing, where are the biggest priorities in terms of where these units will be distributed, and when can communities expect to start seeing them?
Yes, so we have provided guidance, which is published on the use of PCR, which some of them are more point of care PCR testing, and also on the antigen tests. So those are actually published on our website. For sure, some of the key uses are for areas that don't have immediate access, and transportation time, for example, is long. So we're talking about more remote areas, isolated areas, but also, the provinces are in a better position as to where they're most needed. They can be used, for example, in long-term care facilities, high-risk transmission settings, where you can get a more rapid idea of the extent of the outbreak, so you can more rapidly isolate and quarantine individuals as well. And some of them might be deployable, again, in more high-risk settings, like workplace settings, meat packing plants, or other places where, particularly if you are suspecting that there are positive cases, that these kind of point of care might provide a more faster turnaround than the regular system, depending on where you are. I think the Prime Minister mentioned, I think some of the Abbott tests, Abbott ID Now, has been sort of verified by the National Microbiology Lab, the machines themselves, and I believe they're being deployed very shortly, possibly by the end of the week or early next week, and some of the tests kits, if you like, that goes with that shortly thereafter as well. And then the PanBio test as we get them. But how they're deployed within specific jurisdictions is actually up to the province and territories. I believe that the agreed upon approach was more focused on per capita allocation with some holdback, so that if there's outbreaks or surge capacity required, then the public health agency might be able to then deploy some of these held back tests to those areas of most need.
I just also want to follow up on the preparation for the second wave. This was something that public health officials, many people have been talking about. Was there enough done to prepare for this resurgence in the fall, where we're seeing now rising cases in Atlantic Canada, where for months there were next to none, big record numbers in, Manitoba or in Ontario, Quebec. I think you get my point. Was there a misstep here in terms of preparing for what many people have been talking about for months?
Well, I think we're dealing with an extremely complex and difficult situation where over the summer, I think after people have gone through a period of staying at home, this was, people did go out and there may be more, public gatherings. There was, of course, increase in what the provinces felt to be appropriate in terms of gatherings, but there were actual rules applied to those settings as well that people are meant to observe. So I think people did try their best, but the virus is, one that can spread asymptomatically and otherwise. So I think getting that balance is actually very difficult, but it is something that we knew we had to prepare for and, get the population prepared as well. But getting the balance is, I think, extremely difficult. You're going to see this in the Quebec context or in the Ontario context as well, where, maybe things did get loosened up more than one expects, and it's everybody's business, as we said, not just governments, but the population being able to contribute. At the same time, what is that balance? everyone wants to get schools opened. They want to have not just the essential businesses, but some of the other sectors opened as well. But as a result, it looks like some of the rebalance had to happen. If you're now getting outbreaks, which one may say, well, you know, some of those settings, one might have predicted that they are ones where spread could occur. But I think public health officials were saying, well, let's just give it, you know, give people some of that increase mobility or interaction. Let's collect the information. If we see that outbreaks are happening, then they will not hesitate to, you know, clamp down on some of those settings as well. So I think you're seeing some of that. What I think is going to also be difficult going forwards is not to have this sort of very marked up and down yo-yoing kind of effect in the outbreak trajectory, because it's very difficult to keep opening and closing. You need to fine-tune the sort of reopening again so that you can have a sustained rhythm where it's more predictable in terms of what the population is going to expect. But I think the bottom line is nobody has that precise playbook. You in every community, you're in a different context, whether in a big city or a small town, that balance might actually be a bit different. So this targeted approach, people are giving it a really good try, but it's not going to be easy, and we need everyone to collaborate on that front.
Thank you, operator. We'll take another question on the phone.
Thank you. Merci. Next question, Paula Newton, CNN, line open.
Good afternoon, and thanks for taking my question. This is regarding therapeutic drugs, and of course, we've seen what happened with the President of the United States in terms of taking Regeneron and the other therapeutics out there that work in the same way. There is a Vancouver company, it's called Abcelera. I know the federal government is involved with them in trying to develop not the same therapeutic, but a therapeutic that works in the same way in terms of this antibody therapy. Now, in a release, they said that, in fact, on a clinical trial at phase 2, so a stage 2 clinical trial, they had seen a 72% risk reduction outcome. I know it was only on 275, but could you please let us know kind of where you are, where Health Canada is in terms of taking a specific look at this, and whether or not in any way, shape, or form, whether there was an application or not, because I don't think anyone's interested in getting, involved again in another debate about the rapid tests, right? The point is, if you have a loved one today in Canada diagnosed with COVID and they're in a group of vulnerability, is there a time frame at which you would see any emergency use of this therapeutic?
And I'll certainly encourage you to follow up with our regulatory colleagues at Health Canada. I mean, I think there's been interim orders, certain emergency use pathways that are enabled for people to get access to medication and treatments. And I know that there's been concerted efforts amongst different government departments to support some of the Canadian companies more specifically. And so I know that antibody therapies is one of the key streams of therapeutics of which the government's particularly interested in that support. And there are certainly ways in which Health Canada, again, I think they will reiterate that they're not going to let unsafe medications that has no proven efficacy sort of be provided to Canadians. They will do their job into ensuring that doesn't happen. And clinical trials, there are ways to sign up to clinical trials and get access to treatments as well. At least you would then be captured within the collection of the data within that clinical trial context.
And if I could just follow up on that, if we look at Canada's most vulnerable group, so where our mortality has occurred, which is 80 and above, but let's say 70 and above, would you, as our Chief Public Health Officer, would you want to see a really detailed look at that phase 2 trial to see if perhaps more of our older, vulnerable Canadians need to have access to that, even on an emergency or compassionate basis?
I think depending on the parameters of the effectiveness of the antibody treatments, and there are different ranges of them, I think some of it is also down to, and as in many of our emergency use applications, are down to the clinical assessment of the person, whether they're in the hospital or the ICU, making that kind of clinical judgment and decision. So, of course, treatment should be provided according to the range of where they are effective. So some treatments, for example, are best used at the beginning of illness, and others are used when someone is more sort of further along in the clinical course and are sick. So I think that depends. But of course, our primary objective is to reduce serious illness and the severe outcomes. So treatments that are able to do that are absolutely welcomed.
Avant de passer avec les questions dans la salle, on va juste remercier Monsieur le ministre Leblanc car il doit quitter la conférence de presse.
There we go. I wanted to ask you about Johnson & Johnson pausing its test on its COVID vaccine. I understand this is not unusual, but I'm wondering if you think that this makes it, that it could take longer for a vaccine to be developed for COVID.
Well, I think as you've pointed out, this is a normal part of the process in terms of the clinical trials. So there are independent data monitoring safety boards. And I don't know the details of the reason why the trial was paused, but they'll be looking at that data in more detail. And I'm sure we will hear about what that evaluation looks like. And I'm sure people will resume the trial as soon as they are satisfied that patient safety isn't compromised. We have seen this scenario once already with the University of Oxford AstraZeneca vaccine, and that clinical trials had resumed fairly expediently after a thorough review. And so we'll just have to see what happens here, but everybody knows that we need to be as quick as possible, but never compromise safety.
Do you have any, I mean, at this point, given the information that's out there, the information that you've seen, have you got any kind of estimate about when we're going to see a vaccine developed and put in place?
I think we don't have the phase 3 clinical trials data, so I think that is the key critical time point. And as you've now seen, sometimes the critical path is X, but you've now added an extra time frame because of stopping of some of these trials. So I don't think it is that predictable, but the majority of the phase 3 trials are scheduled, at least at this point, to have some information by sort of the November, December timeframe. Having said that, just because you have the result of the clinical trial doesn't mean that there isn't a lot of other steps that has to be taken before a vaccine gets into a sort of population program as well.
Thank you. Next question.
Tonda McCharles with the Toronto Star. Dr. Tam, the Canadian nurses are again pressing their concerns around aerosol transmission, pointing that the U.S. has changed its guidance. And I want to know where you're at on the idea of aerosol transmission of the virus and whether or not it is you have changed or will change the federal guidance on it. What does that entail for workplaces and the like?
No, that's a great question, and you know, there's more and more science and data as well. I do think that you know, there's different scientific disciplines, and the information is now being pulled together. But I think we would acknowledge that when someone coughs, sings, speaks, shouts, in particular, that if they're infected, these viruses could be carried in different size secretions or droplets. The smaller ones that don't immediately fall to the ground, the finer of these droplets, of what we call aerosols, might get suspended in the air for a longer period of time. So that's what we're sort of talking about. And I think they exist, and that, but the circumstances and the importance is still being worked out. What we did do, though, quite earlier on is looking at the fact that some outbreaks have occurred, in particularly enclosed, poorly ventilated, crowded conditions where people sang or shouted, was the fact that actually pointed to the fact that aerosols could exist under those circumstances. Those three C's, the sort of closed, poorly ventilated, crowded, close contact, particularly face-to-face, without any protection, is where the larger clusters or what we might call super spreading events might happen. So in anticipation, I mean, the scientific discourse is catching up, but we, even more than ever, need to promote that concept. And so I think in addition to that, you know, completely promote going outdoors if you can, open windows. But what happens if you're in a sort of winter situation? So some of the additional recommendation we're trying to get, it includes making sure your HVAC is surfaced and other measures for which we can enhance those measures. But I think a lot of it is actually amplifying what we've already said before, and masking indoors when you're not with people in your household, and certainly when you can't maintain any kind of distancing, or that you can't have that be assured. But certainly masking indoors, universal masking, looking at those, you know, improving ventilation would be the sort of circumstances where you can reduce the impact of aerosols. I think from the perspective of the healthcare system, we continue to look at that hierarchy of controls. In certain healthcare systems, particularly modern hospitals, ventilation is actually very good in many aspects of the hospital, and there's administrative controls maintaining those distancing. But the agency currently has a guidance which provides for what we call a point of care risk assessment. If a healthcare worker in that setting feels that they need an N95 mask because it's the best use for that moment in time, because they know what situation they're working in, they've got a patient who cannot wear a mask, they're coughing violently, you know, those are the kind of settings where healthcare workers should be provided with the right equipment so that they can protect themselves. We also had recommended universal masking policies in healthcare settings. And so because, in fact, some of the risk to healthcare workers is actually people that you don't know. They're asymptomatic, they're pre-symptomatic, you don't actually know that they are carrying the virus. So universal masking was something that we had already advocated. Given evolving science and evidence, we will, of course, go back and have another look at whether certain aspects of the guidance need to be reviewed as well. What I'm most excited about is trying to get together the different disciplines of science, from the sort of people who are experts in ventilation, people experts in aerosols, together with infectious disease experts and infection control practitioners, to see if we could not find the most, you know, scientifically informed and sensible path forwards. Long-term care, I believe, is one area where I think, of course, that's a high-risk setting. And that's where some of the healthcare workers who were most impacted were located during the first wave. And again, we must provide them with the protection that they need in order to do their jobs as well.
And can I see that we're still somewhere anywhere between 34 to 37%, I guess it depends on the day and the week, of the source of COVID infections being unknown. And I wonder, is that a failure? Are we basically saying that contact tracing in this country has been an utter failure? If you can't trace, can't identify, can't say what more than a third of the cases are the result of?
Well, I think that's a important indicator to keep an eye on. And of course, that changes every day. So the moment you get a new person who's identified and you have to trace their contacts, there'll be a period of time where it's like a revolving door of that 30%. They're not the same 30%, but they may change as people catch up to doing the contact tracing. But it is concerning because, as we heard, the public health system and capacity is not limitless. So people still have to do their part and limit the number of contacts. If every person who is a case and the public health has to contact like 20 people, and of those, if you find another positive, they have to do the same, that is not actually that manageable. So I think we have to, again, find that balance of everyone doing what they need to do to reduce contact together with the public health system's capacity, which is continuing to be reinforced as well. So I think it is something that we must keep in track on, but the rationale or the reason behind that 30% might be different in different jurisdictions.
Prochaine question, Radio-Canada.
Docteur Nou, expliquez-moi les risques que vous voyez avec l'Halloween. Des petits monstres qui se promènent de maison en maison, de porte en porte, échanger des bonbons, etc. And Dr. Tam, please feel free to jump in also in English. What risks do you see associated with Halloween?
Merci pour la question. C'est dans quelques semaines à l'Halloween. Je pense que, d'après moi, ça, c'est une occasion importante. Il faut garder toujours, comme dit, des événements, des occasions importantes pour notre société, et c'est très important pour les enfants. Donc, j'encourage l'Halloween, mais c'est aussi avec des bonnes pratiques de mesures de santé publique. On a déjà constaté plusieurs fois, c'est quoi peut-être les 3 principes les plus importants? C'est toujours la distanciation physique, le port du masque et aussi le lavage fréquent des mains. Donc, je pense qu'avec les 3 comme des bonnes mesures de santé publique éprouvées, on peut avoir Halloween. Je pense que, je ne sais pas ce que c'est actuellement sur notre site web, mais on a élaboré aussi des orientations, un peu des guides pour les autorités aussi, pour tout le monde, pour savoir c'est quoi les bonnes pratiques en principe pour avoir une Halloween en sécurité. Je pense que, d'après moi, c'est pas la même chose dans tout le pays. Je pense que les Canadiens sont résilients. Ils sont capables d'adapter. On a bien adapté même les pratiques, les traditions pour l'Action de grâce. On a vu beaucoup de solutions créatives, même avoir comme des laptops, comme des célébrations virtuelles. Pour l'Halloween, ce n'est pas la même chose. Je pense que toujours c'est possible de donner des bonbons, recevoir les bonbons d'une façon sécuritaire.
Yeah, just to add that, again, is finding a balance. One is that you should listen to your local public health direction because activities are different in different parts of Canada right now. But I think finding that balance of trying to provide some degree of normality, even though it is actually different from any other year. Most public health leaders think that is actually important, but how do we adapt to the new realities of the new Halloween? So I think trick-or-treating outside with the right distancing, pre-packaging your treats so that people are not rummaging in a bowl of their bonbons, candies is actually important. Having hand sanitizers for your kids, wearing a mask, and sometimes you can actually use different fabrics to turn it into part of your costume. But there's some really interesting ideas where people are handing out, treats at the end of a hockey stick or something, using a pool noodle to tell your kids how far they should be standing apart from each other. So there are ways to actually manage this. Outdoors, in particular, we just talked about the potential for indoors being a higher risk. And so I think that's some of the safest way of doing trick-or-treating. But we will also have tips on our website for people to look at as well.
Merci, docteur. Prochaine question, Global News.
Next question, Global News.
Can't believe there's not a follow-up to that, sorry. I just wanted to ask Dr. Tam on long-term care facilities. The Prime Minister did say that the time has come to harmonize regulations across the country. Why is that not happening more quickly, and how key is this in fighting the virus?
Well, I think to protect seniors and long-term care needs many different layers of approaches. So having norms and regulations is but one. I think from the public health perspective, we provided guidance, but you need to look to see if people are following the kind of infection prevention control guidance. At the same time, you also need to make sure training is done and that people are taking those measures. But a lot of it is also shoring up human resources, because we know that a lot of the difficulties is the lack of staff, supporting some people who are actually earning very low wage, personal support workers and others, to be able to do their job safely is very important as well. Making sure there's PPE supply, where there is any inkling of anybody ill, rapid access to testing and broader testing for those high-risk settings. So there are many aspects, I think, of the long-term care high-risk situation where you know, everyone has to play a part in that, and you know, it is an absolute priority during this resurgence. That's all I can say. And the federal government is doing certain things to support this. But also, if you think about the governance for long-term care, is fairly distributed. The federal government has had, you know, is a provincial jurisdiction, but it's also divided between the private sector and the public sector. And so every one of these sectors and the players need to kind of get on board and make sure that all the layers of protection are in place.
So just as a follow-up, as the country's top doctor, how much of a priority do you think this should be, and how much are you urging this government to just take long-term care facilities almost away from the and out of the private sector as well? Because it sounds to me, and correct me if I'm wrong, it sounds to me like you're saying the fact that it is this patchwork makes it almost impossible to fully fix it.
Well, I mean, that's a discussion that's for our political leadership, but I think we've set out the appropriate approaches, and everybody, as I said, everybody needs to do their part. Some of it, and don't forget that some long-term care have managed quite well throughout the first wave, and others, is learn from those who have done it well and make sure that that also apply to ones who may be struggling as well. There are some long-term care facilities, I haven't heard of too many of them, but they're experiencing not the first, but second or third outbreaks. You need to, you know, have enough information, which happens at the local level, as to, well, which institutions or facilities or homes or residences do you really need to pay particular attention to. That's quite a granular set of response requirements, which I think it is best done on the ground where people can do those assessments. At the same time, you know, the federal government does have its role. So I think the Prime Minister is emphasizing some of that. But I think my key message is that having seen what we've seen in the first wave, the top priority, really key priority, is to protect seniors and long-term care, not just pertaining to those specific locations, but how we manage community transmission is important. By keeping that low, the chances of viruses entering those particular high-risk settings will be reduced. So I think it's a multi-pronged approach, but very much a priority.
Thank you, Doctor. Last question, Canadian Press.
My name is Mohammed. I'm with the Canadian Press. Dr. Tam, we learned over the weekend about a super spreading COVID-19 event at the Spent class in Hamilton, in Ontario. And I know, like, you have always preferred to leave local decisions to local health authorities. But do you think there is a danger that in patchwork health rules, when one case can create a risky environment for dozens of people catching the virus?
So, I mean, I didn't quite catch the specific event you're referencing, but yeah, I mean, we now know that there's certain settings where larger numbers of people can get affected, and we've seen even in the past week some of those outbreaks being reported. So some of them are work settings, some of them are, food and drinks establishments, some of them may be related to private events. So we're still hearing reports of, unfortunately, weddings or culturally very important events for people, such as funerals. So we must double down on providing the infection prevention and control measures for those settings, because we know that's where cases can spread more rapidly. Local jurisdictions are looking at, of course, still making sure that the size of those gatherings and events are manageable as well. So they're providing that direction. But yeah, I mean, in many ways, we know the settings where things can happen. And, both public health and the public needs to both do their part to reduce those risks.
Right. As a follow-up, we have seen cases, we have seen increase in cases since mid-September or maybe late August. And you have been sounding the alarm for people, they have to respect the rules and wear masks and so on. What other tools do you have if COVID cases continue to rise?
Well, I think, what I said is true in that you need both shoring up the public health system, so increasing testing, contact tracing capacities, and isolation. The federal government is now putting up some isolation facilities so that people who can't isolate at home can go and isolate. So that's the foundation of the public health capacity that needs to build up. And you can continue to build that. But again, that still has a finite capacity if the public isn't always doing its part. So I do think that we have to look at different ways. Some of it is still communication and better communication, but others are happening at the local setting where more rules are being put down on the ground, and people are also looking at fines and other measures which are being done at the local level, which people don't necessarily want to do, but it may be one of the tools that's going to have to be implemented.
Yeah, Dr. New, maybe I can just add to that. At the end of the day, just to simplify, we know how the virus spread. It's contact between people. And so we also know what sort of the main tools we have, which everyone has at their disposal. Everyone knows the right public health measures, wearing of a face covering or a non-medical mask, physical distancing, frequent hand washing, because we know the modes of transmission, contaminated surfaces. It's passed through the air through droplets, or as we just talked about, also with aerosols. So it's there. The challenge is that in our society, it's a combination between activities people do in the privacy of their homes or in private settings versus what happens in public settings. And the combination of the relative contribution of people spreading it in private situations versus in public settings, that's a challenging part. So in terms of tools that governments can undertake, certainly with regulations, the hospitality industry and so on, yes, if it comes to it, relative to the contribution or what might be causing certain outbreaks in certain areas, there could be certain things like, closing bars and restaurants and so on. But unfortunately, what we're seeing is that there's also a very significant proportion of what happens, quote, in private settings, as Dr. Tam mentioned, be it the weddings, private parties, and so on. So how do you deal with that part? We've talked about it. Prime Minister, everyone's exhorted the general public to do their part. We're trying to use a segmented market approach, trying to hit different demographics, et cetera, and so on. At the end of the day, I think we've mentioned it several times, it comes down to hopefully a personal responsibility, almost like a civic duty, saying, hey, everyone needs to do their part in terms of helping to stop transmission by avoiding contact. Personally, I would say something as simple, hey, even the wearing of masks, wear a mask all the time unless you're in your home with your own household contacts that you see every day that are also practicing the same sort of tight sort of public health measures you are. Otherwise, even if you have visitors coming into your home or you're going outside, wear a mask. So people, I think, just have to start, realizing it's serious. We talked about young people, but it's people of all ages, I think, that everyone needs to reinforce what they do. And I think, yeah, unfortunately, we're all suffering from COVID fatigue, and we're now coming into our winter, I'll be the first to say it, hey, winter is coming. So let's get on with it. Thank you.
Thank you very much. That'll be all for today's press conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui.